looking at all of the chronically street homeless tenants who entered CUCS Common Ground Housing between September 1st, 2007 and the end of 2008. So basically that was from the start of this whole initiative. And at the time that meant 52 street homeless folks and 46 long-term shelter stayers in the comparison group. We essentially weren't moving in anybody who wasn't chronic in one way or another, so we dropped there were like 4 people or something who weren't chronic and they weren't worth including. One of the interesting things is that, as was mentioned, people were coming from different sources. So 58% of these tenants, of the street chronic tenants, actually did come through transitional facilities, in some cases ours, in some cases other folks. 25% came from some of these other sites that had been created for this purpose that were just described, and 17% came directly from the street. And we'll look later at a little bit about what happened with that. Our design was, this was a multi-method study, which means that we had some qualitative stuff and some quantitative stuff. So we had a bunch of focus groups at all 3 sites where we had a qualitative person who met with groups of management staff from both the service provider, CUCS, and the building management, which was Common Ground. Also met with the managers of those groups and also met with the street chronic tenants. So the qualitative thing wasn't comparison on the tenant end. The idea was just to meet with folks and find out how they were experiencing the housing and whether it seemed like the service mix was appropriate to the population or whether we needed to do something really different. And we also did a quantitative analysis of lease compliance data that Common Ground maintained, and we'll talk about that later. And the core thing was really a quantitative analysis of the service contacts with CUCS staff, both in terms of quantity and also some things about the nature of those contacts and the services provided. Okay. In terms of those tenant characteristics, there were a lot of measures on which tenants did not differ, where the street chronic folks looked a lot like the shelter chronic folks. There were a few that were important where they did, though, and these were them. First of all, substance abuse. So we had about half of the street chronic folks who had active substance use disorders versus around a quarter of the shelter chronic. Also, cognitive disorders, which turned out to be really important and which we hadn't particularly been thinking about going in. So again, here a really dramatic difference. About a quarter of the street chronic population had cognitive disorders. And this is things like learning disability, diagnosed mental retardation, organic damage of long-term substance use, things like that. Versus a tiny number of the long-term shelter stayers, I think a couple of shelter folks. And PTSD was also, unsurprisingly, much higher in the street chronic population, though it didn't actually turn out to be that predictive of other things we cared about. Okay. As far as the qualitative findings, this is the focus groups. It was pretty interesting. So I should just say, when we went into this, back a few years ago, there had been this push to house long-term shelter stayers. And at the time, there was a lot of concern among providers, including ourselves, that long-term shelter stayers would be a really, really difficult group, and the city wasn't going to provide extra funding or what have you, and so we were worried about it. And so we did a study, actually, not this well done, and it was sort of a preliminary effort, but looking at the differences between the long-term shelter stayers and other folks in our housing. And we went in thinking that the long-term shelter stayers would be bad news, and we found out that it wasn't true at all. And if anything, they were seemed to be a little less work than the rest of our population. So when we went in to do this study, right, we drew the perhaps obvious conclusion from that, and we were like, oh, we've been down this road before. Everybody's thinking these guys are going to be a big hassle. And we thought so last time, and we were wrong then, and we're going to be wrong again. So we went in expecting that actually probably the street chronic folks were not going to be particularly challenging, and we're seeing sort of an analogous situation. And initially, our qualitative findings seemed to bear that out in the focus groups. So the tenants, first of all, were generally quite happy with the programs, the services, and the staff. Not to say universally, and certainly there were suggestions and complaints here and there, but there wasn't anything that suggested that there was a fundamental mismatch, or that these folks were dramatically different or needed something that we weren't providing. In terms of the Common Ground staff, they just flat out basically did not perceive the chronic street homeless as requiring more time or effort or being disruptive or particularly interesting. Both the CUCS and the Common Ground staff thought that the sites were appropriate settings for the population, which was kind of the bottom line that we were interested in. And the CUCS staff though they thought there were a few exceptions, there were a few clients who were more service demanding, took up more time or whatever, the perception was that in general, that wasn't the case, which was interesting, and we'll get to later. So one of the things that was going on in these focus groups that we didn't realize at first was that we only did have, at this point, 56 chronically street homeless folks in these housing sites, which was something like, like 1 per staff person, give or take. And so people didn't really have, it wasn't like a large proportion of their caseload or their work represented by this population, and a lot of them hadn't been there all that long, necessarily. And so people had, in some ways, somewhat scanty experience. They were drawing from a little, sort of a narrow window into what this work looked like. The other thing, though, that came out of these focus groups that I think has remained true and is actually really important was that people also staff, especially I think service staff, really did talk about the unique, the rewards of working with the population. So whether or not they saw the population as taking more work or being particularly different or what have you, there were a number of people in different programs on different teams who talked about that it was qualitatively different when you felt like you had helped somebody who had been on the street for 20 years to really create a life for themselves in housing and see the incremental improvements that they were making, and that those rewards really were different and carried a much bigger bang sometimes than the the emotional rewards they got from working with the shelter homeless folks. And I think that in our business, obviously, we're dealing with bad outcomes all the time. We're trying to prevent bad things really frequently, and we're also very focused on sometimes like bad things or challenging things happening in our programs. So one of the things that came out of this, I think it's very important to not forget about the positive things that happen. Like, we're trying to also create positive things in people's lives. It's equally important to create positive experiences in our staff's professional lives and our site's functioning. And that's something that I think this population has done and that came out in these focus groups. Now, the interesting thing, though, is that in terms of time and effort, the staff were just plumb wrong, just flat out. And we'll talk a little bit about why that might have been. So this is a graph of the average contact hours in the first year after entry. So this is adjusted for each client. It starts with their move-in date, right? It ends with 12 months later. So it's not a cohort. Each person is for their initial year, right? And as you can see, the dotted line is the street chronic group, and the solid line is the shelter chronic group. And you can see that clearly, not that you need statistics to deal with it, but clearly and statistically speaking, the chronic street group is considerably higher. Okay, and it's higher all the way through. There's kind of a bump there in the middle, it looks like, and then it's a little lower at the beginning and goes down a little more at the end. And what we think is going on there, though there's no way to prove this right now, is that it takes a little while. Like, the street chronic people come in and they're fairly self-sufficient in a number of ways. They're much more used to functioning independently because they've been on the street. It takes a while to actually recognize the depth of the needs that a lot of folks have. So even though they're more work to get settled, it's not quite as much more work as in the middle after a few months when you they start to open up a little bit, trust the staff, you start to recognize really what kinds of services they need, and then it balloons, and then you catch up a little bit, and that gap closes. That's our best guess as to what's going on. But in terms of that first year, the overall just like sort of resources required, and in terms of staff time, which is really our resource, is about double. So they're about twice as much work in terms of actual staff contact time as the long-term shelter stayers. And that's not inconsiderable, right? It's a big deal for those of us who are doing a lot of this work. You double something, it's got to come out of somewhere. So we did a bunch of different analyses to try and figure out what was happening here. And important predictors of contact time between and for these groups, right, was essentially substance abuse and cognitive disorders. And cognitive disorders, for people who had them, was actually probably the most powerful predictor. Folks with cognitive disorders required more time than anybody else. Substance abuse was also a powerful predictor. And if you adjusted for these things, right, because remember we have more of these disorders in the street chronic population, even after adjusting for them, the contact time was still about a third higher for the street chronic population. So there's a chunk of extra time that has to do with the preponderance of substance abuse. There's a chunk that has to do with the cognitive disabilities. And then there's like another chunk left, another third, that might be just sort of general behavioral patterns and socialization and what have you. In a way, though, that controlling for thing doesn't really matter operationally, right? It doesn't, like, you could have a complete explanation and account for 100% of whatever this difference is in terms of some variables. In the end, they're still there. It's still that much more work, and operationally it has the same impact. Now, once we controlled for those variables, though, some interesting things happen. So first of all, sex, the site, right, the different programs that they were in, PTSD, none of those were predictors of contact time. So once you controlled for substance abuse and cognitive disorders, the rest of this stuff was irrelevant. And so was previous living situation. So one thing we actually thought might happen going in here is that we would find that people who were coming through the transitional sites were less work than the people who were coming straight from the street or coming through the stabilization beds or whatever. And that actually was not the case. Now, that may or may not mean that it's hard to know what that's saying about the impact of the transitional programs, because what might be happening is that you've got people who are being accepted from the street because they're more palatable in the first place, or they're less behaviorally problematic or what have you. So it could be self-selecting, or it could really be that the transitional programs, whatever they're doing, are not actually making people like easier when they get in housing. It's hard to say. So after the study, right, some different things happened and the world changed a little bit, or seemed to. And what happened? Well, the biggest thing that happened is that we had a whole lot more chronic street homeless tenants move in, as was just mentioned, right? So at this point, today, or yesterday, or whatever it was, in these same 3 study sites, right, which at the time of this study had 56 street chronic people, we now have 198. And 198 of anything is a lot more than 56 of anything. It doesn't matter what it is, right? And it turns out that goes like double for street chronic clients. And in fact, at this point, CUCS and in our partnered housing, we have a total of, I think, 350 plus street chronic folks overall, which is just over around a third of our entire special needs tenancy. So it's a really big population now. Along this time, the anecdotal reports from CUCS staff that were filtering through to me were that people were seeing the population a lot differently. That these folks who had been in these focus groups and said like, everybody's kind of the same or whatever, no longer felt that way. And I heard enough of this that we did a follow-up survey, not for the study, but just to get a read on things, that seemed to confirm that the staff views had really changed. We saw increased incident rates at especially at the sites that had like 100% street chronic folks. And those incident rates were significantly higher for the street chronic than our other special needs tenants. And that didn't seem to be affected when you controlled for move-in dates, so it wasn't just because they were newer. We also did some work with our management teams that went back to their staff and identified problem tenants, people who were threatening and or violent at the sites, and then came back and took a look at that, and it turned out that, again, the chronic street homeless tenants were much more likely to show up on those lists. While we were trying to think about how to deal with this, we went and retroactively did some full criminal background checks, because it turned out, I don't know if anybody else had this experience, we were surprised, but it turned out that the criminal checks that we were doing, or that were being done prior to people moving into housing, were these free online checks that just did the state prison system. And all of the criminal records were all in the city jails. Like, nobody was in the prison system. You have to really impress somebody to get in the prisons nowadays. So we went back and retroactively paid for like 75 of these real criminal record checks and found out that there was this really high level of pretty serious misdemeanor convictions in the population that nobody knew about coming in. And then finally, it was just that, though this wasn't necessarily a good or a bad thing, but the proportion of male tenants in the buildings was going up, in some places going up quite a bit, just because 90–95% of the chronic street homeless population is male. And so where we were doing almost 100% intake of chronic street homeless people, it meant we were doing all males. And that was shifting that balance. What do you think was happening here? Like, why was this so different? First of all, and again, this is all anecdotal, right? The study is pretty reliable for the time period it's about. There were a lot of controls on it, a lot of rigor. This stuff, much more speculative, but hopefully helpful. So first of all, it looks like that initial cohort of chronic street homeless tenants were in some sense easier. So although it was a worst first model, people actually had to be willing to move someplace or engage to do anything. And so in that first year and a half or whatever, some of who moved in was who was willing to move any place. And so we heard anecdotally from the housing teams that it felt like, not that those people were less homeless or anything, but they may have been a little easier to work with. Another thing is that since we had these growing numbers of this population in the housing, it meant that each staff person had usually a few people on their caseload now. They had more grounds for comparison. It also just figured bigger in their lives. So they're paying more attention. So when we sent around a survey or whatever, this was something that was really on people's minds, whereas when we did the focus groups originally, it was really almost irrelevant to their work. It was sort of a real side issue for them. Another thing that we just did not see coming, and that almost certainly mattered a lot, was that we sort of implicitly thought when we started the study that problems would show up right away, and probably they'd show up worse than most earliest. People would show up and they'd not have settled in or whatever, and all heck would break loose. And it turned out that actually for the clients who were really problematic clients, it took a while. So there was some kind of honeymoon or period below the surface or whatever was going on. And so it took at least 6 months for our staff to recognize that somebody was really causing problems in the milieu. And often it took considerably longer. And so since we only had a 12-month study, we didn't capture a lot of that. And then, of course, once staff recognized that we had serious behavioral problems in that minority, it also took some time to actually resolve. So just the fact that you noticed it doesn't mean it goes away right away. Whether that's behavior change or eviction, those processes take time.